episode with the farmer. So in this video, we wanted to actually talk about turkey. We started in our previous video. We started with how you can actually start a turkey farm. So, and one of the important things to consider when you wanted to start any farming is the difficult side of it, which is disease. So we have here. Someone wanted to talk about the common disease that you surely encounter if in the beginning or in the middle, definitely you are going to encounter them. That's the disease in turkey. So how you can actually prevent and how you can actually cure them. So let's talk about turkey disease.
Okay.
What are the common turkey diseases that someone that is starting a turkey farming will actually encounter?
There are most diseases that you want to be encountered. One is raising turkey, of which number one is the coccidiosis. Coccidiosis is when the intestine have infections, and the oculus that they pick from the litters as incubate, as germinate. So then it brings out red poo.
Okay. So at what age can turkey has coccidiosis?
Turkey of 3 days can have coccidiosis, depend on the hatchery.
Okay.
Now it all depends on how you can curb it. Now
before we talk about what is the way to prevent it first before we now talk about curing it eventually?
There are ways to prevent the disease, which is coccidiosis. Number one is that you have to make the litter to be dry, not wet.
Dry litter. So
once the litter is not dry and their food is not wet,
you are certain that
you are safe.
You are safe that there will not be. That means someone needs to manage the litter
very well.
Very well.
Yes, sir.
So that's one of the preventive measures that someone can actually consider. So what are the things? Let's talk about the drug that someone can actually use.
Okay, is it natural or?
Let's talk about the natural one first, before we now talk about this thing, because there is going to be because there is a bacterial infection, right?
Yeah, coccidiosis.
Okay,
yes,
it's a
bacterial infection.
Okay.
Now, what we can use to cure the disease or to manage the disease goes follows naturally. Now you can use wood ash,
okay, or charcoal.
Charcoal, wood ash, or charcoal.
Okay, maybe we're going to do video on how you can actually use organic way of curing
Yes,
disease. In this thing. So let us limit to
synthetic way.
Synthetic way.
Okay, in the synthetic way of treating coccidiosis, you have to use
antibacterials.
Some drugs that contain sulfurdimidine.
Okay.
Or other one like amprolium.
Okay.
To take care of the
vet doctors.
Yes.
For that.
Now, like I use amprolium, Prococ, Coccifor, Tutolin. Many of them.
So let's talk about number two.
Number two
disease that
you can actually encounter is the pox, fowl pox.
Fowl pox. Okay.
And when you're talking about fowl pox, we have two types of pox. We have the dry pox and we have the wet pox.
Wet pox. Okay. Yes.
The dry pox is when the pox shows in the area of the wattle, the comb, the legs, and sometimes the wings.
Okay.
So now, how you can take care of coccidiosis on the fowl pox and the wet pox is the one that actually attack the throat.
Okay.
Now, how you can take care of the pox is by using the vaccine.
Okay, there is vaccine for it.
Vaccine, yes.
Is there vaccine for coccidiosis?
There is.
There is vaccine. Okay.
There is vaccine we call it Imocos.
Okay, if someone can take vaccine for coccidiosis, you can also take vaccine for
fowl pox.
Okay,
but the vaccine for the coccidiosis will be given to birds at day 3.
At day 3.
At day 3.
Okay, and also, maybe they can even seek their vet
advice of the vet, yes.
Doctor,
yes,
which will be on the safer side.
Now,
so let's talk about the third.
And sorry, sir. And giving the fowl pox vaccine is not a guarantee that the pox will go finally.
Okay.
At the later age, it will appear.
Okay.
You know, vaccine is an attenuate which is given to the animal. Now, when it appears, once you give a little medication, then it clears off.
Okay.
Because you have used vaccine
what I try to get from this part is that even if you use vaccine, doesn't mean that it cannot break.
Yes.
It can break.
Can
and
break.
The disease might come in.
Yes. But with a little medication to clear it.
Okay. So that's number 2. We talk about the coccidiosis. We talk about the foul pox, dry one, and the
wet one.
And what is the third one?
The third one is a CRD.
CRD.
Chronic respiratory disease.
Okay.
You know, they are sensitive to smell.
Okay.
And they can also easily be choked.
Okay.
So when they are sensitive to smell, especially the ammonia in the house. So when they take those things in, or another thing is that when their house is not well ventilated or is overcrowded, CRD will set in.
Okay.
Now when CRD settings, it give sneezing, they sneeze, they cough, and you will see their water is not changing well.
Okay.
So that means that the CRD are setting, chronic respiratory disease. Now when that one comes in, what am I going to do? You can use drugs like Tylosin or Tylodex.
And that's broad
yes,
spectrum
broad spectrum drug, yeah, which takes care of that.
Okay, CRD.
Yes, CRD.
So what is the fourth one that is very common?
Fourth one is very common and can be easily be curbed is the Newcastle.
Newcastle, okay. So we have that in poultry too.
Of course, it's very, very rampant. CRD will happen to the birds, the turkey. Now, CRD shows a sign of they lost appetite.
Okay.
Loss of appetite.
That's some of the symptoms.
Some of the symptoms, the loss of appetite. You will see greenish poo. Also in CRD, there's also greenish poo, but in Newcastle, the poo is different.
I think they will be losing weight too.
Of course, when the animal is not eating well, they
will definitely
losing weight will be setting. So they lose weight and other things like that. So with that one, how you can curb it is by using the vaccine. Once you have given the vaccine and it has taken care of it, then if it comes out, then you can also use drug and later use vaccine
okay,
to clear it away.
Okay, now let's talk these days. Before we round up this video, there is one particular disease that actually comes very does Gomboro affect people?
Yes, it does, but not like in poultry.
Okay, because some people said it doesn't affect Gomboro, don't affect turkey.
It does, but not like in a chicken. Okay. Like now, how does Gomboro set in? Gomboro set in when the house is not well maintained.
Okay.
Disease set in when the house is not well maintained. Disease can attack chicken, can attack turkey. None of them is exonerated from it.
Even human being.
Yes. So when our house is not well ventilated, is not well taken care of.
Maintenance is very important.
It's very, very key. So any disease can come in. Even bird flu can come in.
Okay.
If it's not well maintained.
So what advice are you now going to give any of our viewers that intend to go into turkey farming? Because I think this is the first time we are more concentrating on turkey farming.
The advice I will give is that make your housing well ventilated.
Okay.
Well ventilated, not waterlogged. Because when there is waterlogged, there will be breeding of a mosquito, and there will be transmission of disease, such like the fowl pox.
Anything can even happen.
Yes, anything can even happen.
Where the house is not.
Yes.
The pen house is not neat.
Yes.
Even for human beings.
And the best thing is that you take a well clean plan, and also water that you cannot drink, don't give your animal.
Okay.
Because what you give your animal is a result of what you see.
Okay.
Another thing another one of the disease that I want to chip in. Some people think that it is pox, but it's not pox. If you see their eyes swollen and water be coming out from their eyes, that's not pox. That is infectious coryza. Okay. Maybe we talk on this one in our next video.
In our next video, okay. We'll try to elaborate it, because I think that also affects
A lot.
a lot.
It can affect them a lot.
So don't forget to like this video, turn on notification bell, and don't forget to try to subscribe to this channel. So we're gonna see you in our next video.
Thank you.